If you and your family rely on the NHS, it's really important that you understand this. Keir Starmer has just announced a plan for NHS waiting lists that is bad for patients and good for private healthcare profits. Here are the 3 things he should have done instead. Number 1, he should buy out private sector capacity to build up the NHS. This has already happened in Maidstone and Tunbridge Wells, where the NHS Trust has bought a private hospital to expand NHS capacity and see patients more efficiently. The private sector only has a tiny bit of capacity anyway, and the only way of releasing that is using NHS staff. The best, most efficient way to expand NHS capacity is to expand NHS capacity, either directly or by buying private sector capacity wherever that's possible. Number 2, Starmer should be bringing all outsource contracts back into the NHS. That would save around £10 million a week currently being wasted on private profits. That money is enough to build a new NHS operating theatre in an NHS hospital every single week. Number 3, Starmer should be saying no new PFI, no new private finance initiative style deals that lock in the NHS to having to pay out huge sums to the private sector for facilities that could have been bought within the public sector for much lower cost. This is a waste of money, and the impact is that patients have less resources available to be looked after by the NHS. Starmer is opening up the NHS to more privatisation when he promised to build back better and when Wes Streeting promised not to privatise the NHS. If you want our NHS to be our NHS, share this video.